dentistry. Whoop,
Peace,
whoop.
love, and dentistry.
It's matching shirt day here at the
Yes, it
Unhinged
is.
Hygienists. Anyone listening to this episode today, if you have your Peace, Love, and Dentistry shirt, you should wear it and feel like you're here with us in solidarity.
Wear it, take a picture, and
Put it in the comments.
put it in the comments or hashtag the Unhinged Hygienists, and we will post it.
That'd be so cute.
That
or
would be
any
so
of your
awesome.
cute dental
Yes,
shirts.
Yes.
Like you have your taco shirt one.
I have the one that says I like to do it twice a day,
Oh, yeah.
and then it has a toothbrush.
And then there's like the spit happens and all the other fun stuff.
And then
there's
I
a lot
have,
of good dental.
my Hocus Pocus Halloween, the Halloween one. That's pretty cute too. So
That's cute. People don't understand how much we giggle in dental hygiene school because everything is very oral.
Yep.
We talk a lot about open wide and gingivas and stuff.
Are we recording? Oh, yeah.
I think we are.
Okay.
Hey, welcome back to the Unhinged Hygienists, where we start our episodes however we like.
Absolutely. Yep.
What are we talking about today, Tasia?
Oh, today we're talking about something that has completely changed how I view oral health, all of the healths. Changed
All the health?
completely.
Health in general?
Yeah.
What
Health in
subject
general.
is that?
Well, we're going to talk a little bit about autoimmunity, gut health, as much as we can in one episode.
Okay. We're gonna touch on it. This will be a teaser for future episodes. I think that's good. It's like a little taste test to see if we like
Little
talking
overview.
about this. Yeah, let's do it. Well, let's go.
Yep, because most people think I have gum disease, I have IBS, I have Hashimoto's or rheumatoid arthritis, and they assume that these are all separate problems, right? But what if they're not?
Because they aren't.
What if your mouth, your gut, and your immune system are all having the same freaking conversation?
Mm-hmm.
And your symptoms are just showing up in different places of your body.
The weak spot. That's what leaky gums. Your gums are the weak spot. Listen, your gums are the weak spot where gut immunity and issue problems will show up, people. They are all connected.
All connected. Because I love, that the majority of autoimmune diseases are caused by leaky gut.
They start
because
with gut.
Leaky gut, then you have leaky gum. So where does that start from? So we're going to touch up on some good stuff today.
True. Because one of the biggest misconceptions in all healthcare, but especially in dentistry, is that everything is divided into specialties. And like the dentist only looks at the mouth, and the gastroenterologist only looks at the gut, and a rheumatologist only looks at autoimmune diseases. But
your body really doesn't recognize specialties.
No,
your immune system could give two shits what your insurance company or what category it falls under. It
doesn't care about the code.
No, and what's fascinating is on every single day we swallow billions of oral bacteria, guys. Billions, not millions, billions. And research is now discovering that oral bacteria can actually colonize parts of the gut and influence inflammation throughout the whole body.
Absolutely. And I think this is something that's really progressive and really somehow it shocks people because they're shocked that the rest of the body is indeed connected.
Yeah.
But I love that science is moving this along. So for us in hygiene, it becomes so if the question is if unhealthy bacteria have been living in your mouth, and we now know that your mouth is indeed connected to the rest of the body, where are those bacteria going next?
Ooh, there's a lot of places. So let's explain the oral gut axis.
Do it.
In simple terms. Think of your mouth and your gut as neighborhood, like they're neighbors. Neighboring cities.
Okay.
And they're connected by a freeway.
Okay.
Whatever happens in one city usually affects the other, correct?
That's true.
When we have oral dysbiosis, we don't just see cavities, gum disease. Research is now suggesting that a lot of those bacteria and their inflammatory signals can influence what is happening downstream in the digestive system.
True. And the opposite is true too, right? Because if your gut is struggling and your immune system is struggling, then wouldn't that then go up? And then that makes your mouth and your microbiome more susceptible to inflammation and disease too.
Exactly, because your gut starts in your mouth. It's an upstream and downstream, you know, just
It
like
is
acid
connected.
reflux. It comes up,
Yep.
then it goes
Well, and
down.
why is that such a like strange thought? And I'll be like from the rooter to the tutor, right? I mean, like it starts in the mouth and it ends at your butt. Everybody knows that. So why are we shocked that your gut is in the middle of everything and it has something to do with it? So
And
mhm.
that's a whole other episode on the oral fecal pathway.
That's a fun one. Oh
Yeah.
yes. Instead of your mouth to your butt, we're gonna say oral fecal pathway. That would be much more professional. Way less unhinged. Whatever, Tusia. Why are you trying to be professional today? Stop it.
Oh, Lord,
Stop it.
stop it. But here's an unhinged but true, Miss Lauren.
Oh, give it to me.
You your bleeding gums might be telling you more than your immune system, more than your more about your immune system, sorry, than your actual toothbrush. So,
Oh, yeah? Well, I
yes.
think, and I
Yes,
think your
ma'am.
gut symptoms might be showing up in your mouth before they show up anywhere else.
Absolutely.
Hmm.
And this is where things are going to get a little interesting because we hear autoimmune diseases described as your body is attacking itself.
Mm-hmm. Mm-hmm.
But research now is starting to believe that that's an oversimplification.
Hmm. I always wondered, I wanted to fight against that because the body inherently wants to be in homeostasis. It doesn't want to fight itself. So if the immune system doesn't just wake up one
No.
day and be like, I'm going to eat myself, like something triggered it, something confused it, something activated this inflammation. So
Yeah.
where
Yeah.
do we go from there?
Right. And now researchers or research in general is continuing to show that the microbiome imbalances may contribute to immune dysregulation
Hmm.
in genetically susceptible individuals.
Hmm.
Right. So, yeah.
Yeah. Um, so I don't think that means that the microbiome causes every autoimmune disorder, but it absolutely may be one of the puzzle pieces and a big puzzle piece that we've been kind of missing.
Hmm.
Um, because for us it's like research and researchers have been identifying the oral microbiome changes in conditions that we look at a lot, so that shows up on our medical history forms a lot. So rheumatoid arthritis is one.
Hmm.
Sjogren's, hello,
Yeah.
that one is right in our wheelhouse. Lupus
Yeah.
and IBS. So there are so many inflammatory disorders that we have already been taught to look for and look at, and now we have this gut oral microbiome connection.
Right.
Mhm.
This is very true.
It is true.
Now, that doesn't mean that your gum disease caused those other conditions.
Mm.
But what it means is that we start seeing a pattern.
Mhm.
And patterns do matter, you know?
Absolutely. That's what hygienists notice. That's
Yeah,
what we're trained to do. I mean, and especially if we see you every 2, 3, 4, 5, 6
right.
months, this is where we can really see patterns. And the question isn't, did the oral disease cause the autoimmune or the other
Mhm.
issue? The question then becomes, what role is inflammation in general? Oral inflammation, systemic inflammation. Where is inflammation?
Yeah,
And how is it playing a role in all of this?
because it's true. You see patients who have autoimmune diseases and they're coming in regularly, they're doing all the things,
Mhm.
but nothing has changed.
Nope.
So
No.
what is happening? What is driving that inflammation?
Yeah.
And what role is the inflammation playing pretty much in all of it? But inflammation, I feel like it's one of the most powerful, I can't speak today, common denominators in
Mhm.
modern disease.
True.
I always tell patients, like, what is the root cause of all illness? It's
Inflammation.
inflammation,
Yep. It's an
you know,
itis somewhere. Yep.
and it's not localized. If it's just,
No,
it's not
it's
just in
not.
your mouth, it's not just in your gut, it's not just wherever,
Doesn't stay put.
it's
Nope.
everywhere. It travels,
It
you know?
does. Because it's only one bloodstream, right? One bloodstream, one entry point. We've already discussed that it's one cell thick in
Yeah,
your mouth. So then all of a sudden it's stuck in the lazy river of your body.
yeah,
And so it's going to get stuck. And
yeah,
chronic inflammation is exhausting for your body.
it is.
Exhausting.
Especially if you have periodontal disease,
Mm,
poor
hmm.
sleep,
Hmm.
chronic stress. Our diet is a hot mess between processed food and all the bullshit that they put in it that,
Yeah.
is banned in pretty much every other country. Then when you got your blood sugar issues,
Mhm.
gut dysfunction, I could go on and on, but you're creating multiple sources of inflammation, not just one.
Yeah,
Like it's a compounding
layered
effect,
ones.
you
Yep.
know?
And it's layered, and it never has a chance to calm down. And so I think that's where your body starts waving these red flags like, hey, 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 whether it's gluten or it's, whatever, any of the things that could be that are
Dairy,
all of the hot
you know?
topics, all of them, anything. It could be mold. It could be
Yeah.
a sensitivity to an ingredient in your toothpaste. It could be
Yeah.
literally anything.
Hmm.
But the problem becomes that most of us only pay attention to these flags when they actually become a symptom of the autoimmune disorder.
Yeah. And wouldn't it be nice if
Mm,
we just changed our lifestyle where we didn't have to wait until we were
mm,
presented with all these symptoms and we can kind of
yep.
manage everything before it became like
Mm.
this massive fire that has entered our body. And then it's really hard to kind of put that out.
It's interesting how people really hold on to the habits that made them get to where they were, right? And I we ask the question, right? Wouldn't you want to change X, Y, or Z if you knew it would make you feel better
Yep.
within a 1 day, 2 days, a week, a month, a year? If you knew it added quality to your life and it
Yep.
made you just feel better in general, wouldn't you want to change it? But for some reason, we don't want to. And my example for myself is I have never been a sugar addict. Thank you, mom. I appreciate that part
God
of it. But
bless you.
girl, I love
God bless
salt.
you.
I love salty food.
Hmm.
And Tasia, you know this almost more than anybody else does. I could care less about like ice cream on a comfort day. I don't need to come home and eat a gallon of ice cream. My addiction and my comfort food was goldfish
This
covered
is
in
true,
Frank's hot sauce.
which
I freaking loved it.
is a very big contributing factor to decay, guys. Do not eat goldfish.
For many reasons. There were so many bad things. The
Well,
goldfish enriched wheat products are terribly inflammatory. There is nothing natural about a goldfish cracker. There's
no.
nothing. And then I would eat it literally like a bowl of soup. I would sit there and with a spoon, I would eat my goldfish I'm salivating thinking about it. This is some
So bad for you.
ADMSR,
So
whatever that
bad.
stuff is. So anyway, hot sauce, how I miss you. It's
So
vinegar. It's salt, sodium. It's all of these things that are so
words you
bad for
can't
the system.
pronounce,
Yes,
some food
ingredient
dye
lists that are
number
as long.
something.
Correct. And I think that for me, I had to really almost detox myself from it because that was something I had trained myself to come home and eat a handful of goldfish crackers or whatever. And so this was hard for me but as soon as I got rid of them as part of my regular intake, I felt better. My guts felt better. My skin felt better. I slept better because I wasn't like fueling the fire of inflammation in me. And that chronic inflammatory process was something that I was hurting myself. And I think that it's hard to get to that point.
Yeah,
Whatever the emotional attachment was, I think a lot of times we have weird emotional attachments to
we
food
do.
or issues with other stuff. So,
So what
yeah,
would you say? Because I'm sure it's hard to eat healthy 100% of the time.
yeah,
And even me, it's taken me, a good 40 years to figure out like certain things. And I still will eat some things. So like no one's perfect,
yeah.
but what do you think for you would be like the hardest thing to change? And why is it hard for you to change?
It's all habit. It's 100% habit and convenience.
Hmm.
And I think this is why for Sunday is a very important day for me to meal prep because I get like my afternoon, I spend 3 or 4 hours in the kitchen and I prep lunch and dinner for at least 3 or 4 days to really set myself up for success. Because like we were talking about earlier, if you go to the gym, you if you eat right, if you're on this path, you want to keep it going, right? And I feel like the day I fall off the wagon, I'm like, cheat day turns into a cheat week. And
Yeah.
I don't want to do that because I like my good momentum. So for me, the best thing I've been able to try to do is set myself up for success, but create a different habit.
Yeah.
So, like, I love a big glass of wine. I love it. I am a wine snob. I have taken the courses. I used to own a restaurant. I used to be part of all this fun stuff. And so wine has been like a science project love for me. But during the week, I already know that I am sensitive to it and the tannins. I'm trying to, not have brain fog, or it does mess up your sleep. And
Yeah,
when I got into sleep coaching and really learned about all of that disruption, I said, we're not going to do this to ourselves. So I don't have a glass of wine every night. I've replaced it. I have my fancy glass that I will then put bubbly, like I have a soda
yeah,
stream. I make my
yeah,
own bubbly water. I throw blueberries in it or cucumbers or whatever. And then I feel fancy and I feel like I've given myself a treat. But
yeah.
so replacement therapy, um, change your habit, change it with something better.
And I think sometimes it's harder for people because it's, to eat healthy, it is a little bit more money. Or
Yeah.
if your family isn't supporting that lifestyle,
Yeah.
it makes it a little harder, but
Mhm.
maybe they'll be willing to do it with you?
And you
Small
don't know. And I
steps.
I
Small
consider
steps.
us we're examples, right? And so if somebody sees that we're sleeping better, feeling better, we've quit, we've lost weight, whatever it is that might be a trigger, I kind of feel like that's our role, even just
Mhm.
being dental hygienists and having nice teeth. Like I feel I floss publicly in my office. I don't hide in an office. Anyone can walk past me at lunch and I'm sitting there just flossing. Patients see me because
Mhm.
we have to walk the walk, right?
Right.
So I
Yep.
think that's part of it. But yeah,
All right.
thank you for
That was
that
good.
segue.
Yes. Yes.
Welcome to a day in the life
Oh,
of our real life.
yeah.
So, yeah.
So let's think about like patients, that we have,
Okay. All right.
that we see, and they have,
Yeah.
and I can put myself in this category: chronic fatigue, brain
Mm,
fog, autoimmune diagnoses, digestive issues, because I do feel like that's a very big, it's all
mhm,
connected. If you have
mhm.
any type of inflammation, you have a gut issue.
Absolutely.
Um, dry mouth,
Mhm.
bleeding gums,
All of it.
you know?
Nobody ever explains to us from our training, or I think even the doctor's training, or anyone, or every doctor that you and I have ever been to in our whole life, starting in infancy, no one ever talks to us about the actual connection.
Mhm.
And I think that that's a real problem that stems back, and we can get into the politics of healthcare
Yeah.
and like the American Dental Association, American Medical Association, and then how these schools may or may not have been influenced by big pharma
Yeah.
somehow. We'll talk about
Hmm.
that maybe later. But the fact that we can keep everybody siloed and that they aren't actually talking to each other,
Yeah.
we're making a lack of communication be a profit for
Yeah.
the medical system. So,
Because we want to keep everyone,
yeah, separated.
stably ill and
Yeah,
separated. Imagine if everyone worked together, communicated together.
gosh, in life and in
So
health.
good. Yes.
Like, the divide and conquer concept goes way beyond
Yeah.
anything. I mean, and I think we're being divide and conquered, divided
Divided.
and
We
conquered.
could, I like divided.
We were done divided, and I
Divided.
got divided into this word process right here. And, hey, it's connected. Don't forget.
Yep.
Mhm.
That's, yeah. But I don't think, given all this information, I don't think the answer is like, let's just buy a shit ton of supplements,
No,
you know,
no,
find
that
a
doesn't help
miracle
either.
protocol, start building a health.
Yeah.
From foundation, the answer that I would think is because everyone's different, everyone's system's different. Some people are more sensitive to certain supplements than others. Sometimes you have so
Hmm.
many supplements that it's like, what's even working if you're taking 20 a day?
Absolutely.
I question this, but the answer is to start building health from different foundations.
Yeah. And I think that the elimination diets are always fun, but even just controlling what we can control. So for us, this is why we harp on our patients about the oral microbiome. This is why I will repeat until the day I die that I need you to take care of your dry mouth. Because is your dry mouth a symptom of one of those medications you're on? Does it show me that there's a gut issue? Can I connect it to postnasal drip? Could you please brush, floss, tongue scrape, water pick, and notice if your mouth is dry,
Yeah.
because this is going to be an indicator of what else is going on. And that's an oral health foundation, right? And so if we could then start thinking about the fact that, again, the foundations are connected, I'm not just going to throw the same oral probiotic at people
No.
either, because, again, supplementation. And this is like, I can't wait to do an episode about MTHFR genetic mutations, because
Which
some
I
things
have.
some things just don't work for you.
What? don't I have?
We are gonna get there.
Yep, yep,
I mean, there's enough other things that you can have and not have, but I
yep, yep,
just I wanna make sure that we don't just run after the next fad, right? And I think that research is important, but I also think that don't forget to, look at who funds the study. Who like I'm a big proponent of hydroxyapatite. I love it. I'm a biologically holistic dental hygienist. I don't love fluoride. I don't, but hey, if you get the Costco pack of Crest toothpaste and I'm going to have you do nothing or you're going to use Crest, well, I just want you to know that there are other things out there. So, who does the research and what do we do? So, anyway, I don't know.
yep.
That's where's our practical
That's
takeaways of all this thought process? Let's let's get your oral health evaluated because obviously that's what's
that's
important to us.
important, you know?
And all the oral health, have the oral cancer screening, look at the condition of the tissue. Is it dry? Is it red? Is it delineated? Don't just look for cavities. Don't just look at like normal inflammation that we were taught in school. Look at bleeding points. Chart your bleeding points on your periodontal charting. And
Yeah,
please do that at least once a year. I do that on every patient every time, even the people that I see monthly. I do a perio chart with bleeding every single time I
yeah,
see them. Um, we do disclosing agents, so we're looking at biofilm.
which I
We're
think is
looking
such an important tool, you know?
absolutely. So I realized I posted a photo on one of our hygiene groups recently because I had a question about some idiopathic stain on a patient. And he was like, hey, and I see him every month. Every 4 weeks, this dude
Yep,
comes in with just so much stain on his teeth. And he goes, why don't you post this to your peers and see what they come up with? And I had so many people ask what the pink and purple and teal was on his mouth. And I was like, it's disclosing agent.
yep.
I'm really sad that you don't know that. So, people, if you can get your hands on some disclosing
Please,
agent,
please
please
do.
do that.
I think that's, like, one of the most important tools that
Absolutely.
we have in our little
Yeah,
tool belt because, 1,
absolutely.
you can see where the acidic bacteria is.
Mhm.
You can't tell me that you just brushed because clearly these are the areas you're missing. This was not there.
Yeah.
You know, this been there.
That
And then
can
it's like
also be directly connected to the gut because if
mhm,
we have silent reflux, acid reflux, if we've got this oral microbiome, and this is where I love this part because if it is the acidic bacteria,
mhm,
it tells us so much more than just your home care.
yeah. And then I'm gonna squirrel too because this acidic bacteria, if when you are air flowing, it comes off in layers, right? So if you have
Mhm.
pink, purple would be underneath blue.
Mhm.
So it takes forever to get the blue off. So that just proves to me, like, I'm sorry, but your mouthwash or
Mhm.
certain things that you're using is not gonna penetrate that.
No. No.
That needs to be mechanically removed.
Mhm.
Brushing, flossing, proxy brushing, water pick.
Yeah, mechanical removal. Yeah,
Wo-
as
wo-
it's the analogy that I do is like at the car wash, right? You can take a hose and go and you'll get 80% of the dirt off. But until you touch your car and, use a sponge and actually wash off the dirt, it's not going away because it has this self protective layer, right? Like your body, bacteria wants to live. And since we are more bacterial cells than anything else, and the mouth is the world's best incubator, you
right,
have to physically remove this stuff.
right.
And then if your gut is feeding it and your nasal cavity is feeding it and your oral microbiome is off, guess what? It gets even stronger. It
Yep,
really is trying to live. It's put up all of its defenses
yep,
because the mouth is really like this crazy, ever changing environment, right? Sometimes it's hot, sometimes it's cold, sometimes it's acidic, sometimes it's alkaline. Like,
Isn't it crazy? I just find it fascinating that a lot of people forget that the mouth is part of their body when it's
yeah,
literally like it's going into
the
your
center.
body. There is
Yeah,
a tube that is
yeah.
literally going from your mouth to your anus.
Oh, oh, technical dental term.
And it's all your but I'm just saying, like, it goes through
Mhm,
your whole body. So it's like, how did we get so disconnected? And I
mhm.
feel like takeaway too, because we kind of squirreled here, because that's
Yeah.
what we do. That's why I think it's so important to pay attention to digestive symptoms. And
Mhm,
I know all
mhm,
about those: bloating,
mhm,
constipation, diarrhea, reflux,
mhm.
and I've said it before, like, if you have acid reflux, that is a digestive problem.
Yeah.
There's something that you're eating that your body's like, "No,
Huh.
this isn't working." You got
Yeah.
food sensitivities because we have true allergies, we have sensitivities, and we have intolerances, and they're all different, and they're gonna
Mhm.
affect you differently. But even if you are sensitive, just because 'cause you're not allergic doesn't mean that it's not gonna cause an inflammatory reaction in your body
And then
because it will.
chronically. Yep,
Yes.
exactly.
And those are
And
all
then you never have the
data
chance.
points. Yes.
Yeah.
No. So it's like, and if you're constantly doing it, your like body's like severely overloaded, you know?
Absolutely. It's the same as it's overuse, right? Like you're overusing, you're over abusing. It's a sunburn, it's a workout, it's anything. Like you're chronically abusing this very sensitive area that has a very particular microbiome. So you should really support it. Eat good food, eat real food. Please increase your fiber. Please eat some fiber. Eat some fermented foods if your body can tolerate it. This is also something that we get told, eat your sauerkraut, drink some kefir, have
Yeah.
some of that kombucha stuff, but not
I l
everybody's body likes it.
yeah.
So this is where you have to pay attention. So I think for me, with my goldfish, reduce the ultra processed foods. Shop around the perimeter of your grocery store, stay away from the boxes as much as you can. And because the more whole foods, the more fibrous, the more complete the food is. Research continues to suggest that dietary habits affect your gut and your oral health.
Yeah.
Yep.
And it's yeah. I love kombucha. I think it's
I say I
great.
don't like it. I don't
Uh,
it doesn't make me feel good. It hurts my teeth. Hurts my teeth.
but it's almost like it's hard because I think society makes it so difficult to eat healthy because we are so busy. But
Yeah.
I think the important thing is not, let's go in and change everything all at once.
Mhm.
You know,
Yeah, small
change
victories make a
yeah.
difference.
Yeah, just one small
Absolutely.
thing like a week. Say, this week I'm gonna
Mhm.
not have sugar,
Exactly.
you know? Do that
And
for
then
a few
just
weeks.
notice how you feel. Yeah.
Mhm.
Yeah.
Because when I did all of that, I literally when I started having dairy again, I was like, I was
Mhm.
so phlegmy. I was like, "Okay, this
Mhm.
is not," but I
Yeah.
have also done a food sensitivity test, and dairy was off the charts for me, but, I'm learning slowly, so but,
And I think that to your point, going slow and setting yourself up for success, it's the exact same as going to the gym. We don't just set out and go and run a marathon. You have to start with a
yeah.
block.
Mhm.
And I think that that's important because I also think that it's momentum, right? And so you had your elimination diet, and then you said, "Oh, look, I do feel better." And then when you have that thing that was annoying you, then you go, "Oh yeah, I don't like that. It's
Yeah.
not worth it." Right? That's that's me and Chipotle. God bless my old self, and I used to love Chipotle,
I
and then the
see, I
clean
never
no, I loved it. Oh my god, I would go in there and tear it up. I'd get,
really
like, a barbacoa bowl, and I would get the big bag of chips and their hottest hot sauce, and I would tear it up, and then it tore me up, and
I'm
so
sure.
I had to be like, "Okay, Chipotle, I'm breaking up with you."
But I
So,
think the
yeah,
importance is to create the habit too,
absolutely.
because I
Yeah,
feel like if you just like, boom, just cut it all out, that's not a sustainable way. It's
no,
not gonna become a long-term
no.
solution because then you're
It's a
gonna start
lifestyle
craving
change.
things.
Yeah.
And even if you like chocolate, have some dark chocolate, a
Mhm.
small little square. Don't
Yeah.
deprive yourself of things that you do love. Just try to replace them with healthier options.
Absolutely.
That's
I
all.
think that's what we wanna drive home,
Mhm.
as far as just our health and wellness, but yeah.
But I think too, the important thing is it doesn't matter if you're doing all of these things, if your body's in constant fight or flight. You
Mhm.
need to prioritize sleep, nervous
Yep.
system
Yes.
regulation.
Agreed.
And it's a work in progress for me, but it's like sometimes if you're overwhelmed, just stop what you're doing.
Yeah.
Go for a walk.
That's
Try
true.
not to get
Reset.
lost like I did yesterday.
Reset and stay safe.
Put some meditation music on,
Yeah.
whatever works for you, a podcast,
Yeah.
you know. What is that thing you send me all the time? Panero, is it what's his name? David?
Oh, Eddie Pinero is
Eddie
Your
Pinera.
World Within.
What?
Your World Within has been, and shout out to him. I have been listening to him for
So
a
good.
couple of years now. as I was on my own journey after my divorce and trying to find myself and what my own path was, because I moved back to the States in 2021, I got divorced in 2022, I had a big health scare, I had some other things I needed to go through. And then as I was really determining what was important to me and what all of these pathways meant, Your World Within was
It's so
really the
good.
podcast that led me to this. And he speaks a lot about taking care of yourself holistically as
Mhm.
well. And I think,
He's so great to listen
yeah.
to, like, his messages I listen to on my way to work, and I'm just like,
Mhm.
"This is a great
Yeah,
way to start your day." So if you're
absolutely.
listening and you wanna be on our podcast,
Eddie, hit us up. Eddie. He lives in Arizona. I know
tell you,
he's
go
not very
drive
far.
by, you know?
That's good. I'm gonna be like, "Hey!" But see, I think that this is an important thing for us because we're connecting the dots, right? And I think if he connects the dot for us to for nervous system regulation, and then you and I are connecting the dot for somebody listening about
Yes.
oral health, and then you can really just find, I mean, I think about any of the podcasts that we listen to
Yep,
that just hit a new nerve for us.
yep.
Um, Mel Robbins is a good
Oh,
example. I
she's
mean,
great.
so many little nuggets of
Yep,
good things. And I think don't be afraid to try to find a provider that'll connect the dots, and that isn't just trying to treat symptoms or throw a supplement at you or throw a medication at you or
yep.
whatever, because everything is connected to everything else. So you don't just treat the thing that showed up, you try to find the root cause of what it was that made that thing show up in the first place.
Yeah, and I've actually been listening to one podcast by Dr. Heather Finley, Love Your Gut, that has been really, really good. So if
Mm,
you haven't heard of that, I would say check that out. She's got some really good
okay.
information on there, but, whew, all right. So,
It was a good whirlwind of gut health. I like it.
I
Like it.
also feel that a lot and being in hygiene, when you start talking to patients about stuff like this, it's almost like, who are we?
Yeah.
What do we know? Like, it's almost like they
Yeah.
can't put that connection together where we might know, and we're trying to help them and connect those dots and tell them to go see their doctors.
Mhm.
Go A lot of people haven't gone to a primary care in years. Go get your blood work done. Go get your inflammatory markers done. Create a baseline to see, maybe go get a food sensitivity test.
Mhm.
You need to create some sort of a baseline so you
Yeah.
can see where you're going. Now, if you're doing blood work, I really highly recommend you see a functional medicine doctor because they're going to read those results a little bit differently than
Mhm.
Western medicine is because
Mhm.
my levels of vitamin D show normal,
Yeah.
but given my mast cell activation and other issues that I have, that is not my normal. I need to have more. So there's
Mm.
a lot of things that show normal, but they're not normal. So I think
Yeah.
that, just because if you're feeling symptoms that are off, we know our bodies.
Yeah.
We know how we feel, and when we don't feel right, like, you know it. So when you go and you get
Listen to
gaslit,
yourself.
it's there's
Yeah.
something else is going on and you need to, like, really fight to get those answers, advocate for yourself. And yes, functional medicine is a little bit more, but isn't your health worth that?
Yeah.
You
Well,
know?
and to your point on the other end of that, like if you have a provider, someone like us who shows a clinical symptom, like I'm going to think about what we see in the oral cavity that connects me. So if we say to you, "Hey, I see some inflammation on the inside of the upper, inside of your mouth. I see some erosion on your teeth. Talk to me about acid reflux. Talk to me about snoring. Talk to me about your sleep position." Don't discredit what these clues that we're
Mhm.
telling you because we stare in a lot of mouths. We look at more mouths than you do, dear person.
Yeah.
And if you stare at mouths like we do, that's a weird fetish. I would like you to not make that public, okay? So, and I tell people that I'm like, don't expect to understand the oral cavity the same way that we do.
Yeah.
And these are the things that we're trained to see. So, I want that to be a clue as well because another thing I tell people to think about is you're lying down all night, right? And most people aren't sleeping elevated. And so, if there is an issue, if you have a hiatal hernia, if you have postnasal drip, if you have any of these, they're literally your mouth is in the middle of your nose and your gut, and it is affecting in the middle.
Yeah.
So, these are
So
the things that we're trained to see.
would you recommend sleeping more in a supine position than flat?
I like people I sleep on a wedge pillow that
Okay.
brings me up about 15 degrees.
Okay.
So I don't think you should be in
In
a
a supine,
lazy
but
boy.
yeah.
Right. I don't want you to be flat.
Yeah.
I think slightly elevated is the best because it also helps. It'll decrease your propensity for clenching and grinding and
Okay.
sleep apnea, but it'll also keep anything that could be wrong in your guts out of your mouth a little bit easier. So
I
if you
hope
can handle it,
that everyone listening really truly, when you go to your hygienist, that she's actually talking or he is talking to you about all these
yeah,
things.
yeah, and
You know,
connecting the dots.
I
That's
hope so. So that
what
we're
it really
trying to
helps.
create that shift, I think, where it is all
Yeah,
connected and your gut plays a very massive role in
sure.
your whole body. I had a patient tell me, "Oh, your gut, whatever." And I'm like, I'm so thankful that medicine has evolved because, and I've
Yeah.
said this before, and I'm probably going to say it 100 times because 20 years ago, they said the gut had nothing to do with health. And guys, like it
Look,
has literally everything to do with health. And your
mhm,
dogs agree with me. Someone's
they do.
dogs agree with me. But
My dogs are really hammering home the point that they really want everyone to know that
that
this is an important episode,
this
people. Pay attention
is.
to your guts. Pay attention. Oh, because that's
But
what
if
do we want people to take away from this
oh
episode,
God, I
Sia?
think that your
What is it?
body, like it's not broken. It just
Mm-mm.
needs a little bit of support.
Yeah,
And that's just your symptoms are communication, like and the way
yeah,
that they communicate, and what you
yeah.
are giving to your body in order to help support those different
Hmm.
systems to communicate
Hmm.
well together.
It's listening, right? And I think the more in tuned we get, it's like yoga, right? The more you listen to yourself, the more you pay attention to how you're feeling with anything, your mouth is communicating with you. That's
Yeah.
what inflammation is. That's what dry mouth is. All of these signs and symptoms are a way of communicating. So your mouth is communicating, your gut is communicating, then your immune system is actually talking to us. And the goal is never to silence the symptoms, it's to understand why they're there and to understand the message
Yeah,
that the body is trying to tell us. That's what
absolutely.
we want to kind of hammer home today is listen to yourself, listen to your body, listen to the signs and symptoms because it might be pointing to your guts, people.
Right?
Mm,
Absolutely.
mm.
Your mouth does not lie.
It's true.
It doesn't,
No.
But if you're dealing with autoimmune disease, gut issues, or any chronic inflammation, fatigue, oral health problems, I'm sure we all have something on this list.
Mhm.
Just please know that you are not crazy. You're not lazy, you know, and you're not making it up. I know, especially with autoimmune diseases, a lot of us do
Mhm.
get gaslit, like, you're fine, you're in your 40s. And it's like, no, there is something
Yeah.
going on.
Yeah.
So don't take that as like the end answer.
Yeah.
Really try to find providers who, I'm sure you
Listen.
can go on Google and look at reviews and see what, oh, my microphone. Oh, I forgot. If I
Hi.
hold it away, no one can hear me. I got excited and then I start using my hands and I don't know what's going on, but
I'm glad you brought your microphone up.
there's
See,
a
this
lot
is
of
good. This is you want people to
silent,
hear you.
yeah, there's a lot of silent illnesses, and
Yeah.
it's like just because you can't see the symptoms doesn't mean
Yeah.
that they're not there. And I feel
Agreed.
like a lot of times the symptoms, when they are internal and inflammatory, like you have a lot more symptoms
Yeah.
and people don't get it. But you are
Yeah.
fatigued, you are tired, you
Yeah.
do have massive brain fog. Like there's just days
Mhm.
where you just can't even get up in the morning.
You're not imagining things because if you feel
No.
different, you feel different. And the silent, part of it, how many times do we hear every single day, my teeth don't hurt, nothing's bothering me? Like that, we see people every day with completely bombed out teeth who said, oh, what do you mean? This is a big issue. I'm like, half your tooth is gone. You never
Yep.
felt it. But we don't feel heart disease.
No.
We don't feel diabetes. We don't
Nope.
feel gut issues unless we're maybe lucky enough to have some acid reflux. But most of us don't know because we're just dealing with our own state of normal. This
Yep.
is our own normal. And it doesn't mean that common is good, right?
No.
That's what we keep
And
hammering home
that's
again.
even
But
with
you keep
airway.
asking. Yeah.
When I talk to patients and it's like you ask them like, "Are you tired? How do you sleep?" And they're like, "Well, I'm always tired." And I'm like, "Well,
Mhm.
we've normalized something that isn't normal
Yeah. Agreed.
and it's not okay." So I feel like you just need to be curious
Hmm. Keep
You
asking questions.
Yep,
Keep being curious. Keep advocating for yourself. I
absolutely.
think that, this one is talking about root causes. Let's look for the root cause of why you're feeling. Why are you tired? Why does your gut health, why does your guts hurt? Why do you keep getting cavities? These are all part of the problem. Please do not let anyone convince you otherwise that your symptoms are unrelated simply because they show up in different parts of your body.
Yep.
The what does that have to do with X is not part of it because, like we said at the beginning, it will show up in the weakest spot
Yep.
where your energy has been spent trying to fight a chronic inflammation, is of course where it's going to show up.
Yep. And even me, for example, with my urticaria and angioedema, like the tirzepatide has helped immensely,
Mhm.
but it's not a cure,
Mhm.
right? Clearly, something's happening in my body where there's some sort of insulin resistance that is helping, but why? So
Mhm.
I'm not okay with, if just because you're thrown drugs and it's helping, again, guys, that's fixing the symptom.
Yeah.
It's not fixing
Yeah.
why it's happening. We need to
Yeah.
find out the why it's happening
Yeah.
so we can help hopefully reverse that. So
Puts the
please
fire out. Mhm.
ask questions, advocate for yourself, find groups. There's a whole bunch of groups for like autoimmune
Yeah.
issues, gut issues, IBS, all of that.
Mhm.
Find your tribe, find support because maybe you can get other people have gotten information. I've gotten information from certain
Mhm.
groups where I've like, oh, great, this is fantastic and it's working for me. So just be open
Yeah.
to
Be open
different ways of doing things as well in a more holistic light.
and think because you are a whole being. You aren't just a series of parts. I think we have to remind people every day and sometimes ourselves to think about us as one system.
That's right.
That's it.
I
Mhm.
can't wait to do an episode on oral pathogenic bacteria and gut health.
It's going to be a good one. That's going to be
Yes.
very interesting.
Because
Mhm.
there's bacteria in your mouth that's only supposed to be in your mouth.
But it
But
doesn't know that.
but how is
That
it
oral
getting out?
bacteria doesn't know.
How does it get out?
They're
So
trapped there somewhere. There's a leak. There's a hole.
there's a leak. Okay, there's a leak. But we could talk
Yeah.
about autoimmunity. That's, there's so many different parts of autoimmune disease and gut health that if there's
Mhm.
anything you guys want to know more about, please
Yeah.
let us know. And if this episode helped you connect a few dots of your own health journey, please share
Mhm.
it with someone who needs to hear it.
Mhm.
Please follow the Unhinged Hygienist on Instagram and subscribe everywhere you listen. All of it.
Please,
Every single one.
every
You
single
know?
podcast platform. Support.
Support YouTube, Spotify, Apple, Amazon. You know, please check out Lauren's Myo, themyocoach.com. She does virtual.
Yeah.
Refer to Laura. Good God. I'm going to have,
I think we're done. It's
we're
time
going
for
to,
us. We
yeah,
gotta go eat and
I'm
fuel
going
our
to edit
brain.
that. So please refer to Lauren at themyocoach.com.
Come see me.
And please, if you have any questions or if you want to be a guest on
Mm.
The Unhinged Hygienist, please let us know.
Yeah.
Until next time, though, please stay curious,
Mm.
stay questioning, and remember the mouth is never just the mouth.
Mm.
And that's it, guys.
That's it. I think it's good. This was a good episode.
Yeah,
This was a good taste test into some future stuff that
yeah,
we're gonna do. And I think that this episode is fitting perfectly into what we're trying to talk about with like
yeah,
healthcare hygienists and this
yeah.
philosophy. If you do not go to a hygienist or a dental office that talks to you like this, please find a new provider.
Yes,
Please find a new
yeah,
doctor if they don't think about everything as a whole. And just allow yourself to pay attention to the signs that you're having and please don't be gaslit. Please don't be gaslit. Mm-mm. That's
especially if airway is not discussed.
mm,
Find a new provider. Or if
true.
there's certain questions you ask and you don't like the answer, it doesn't make sense,
Yeah.
find a new provider. But
Listen to your
this just,
intuition.
I feel like for a lot of hygienists who are stuck in that trap of doing the same thing, just listen to this podcast because all you need to do is find something you're passionate about where you
Yeah.
can connect those dots. And that
Yeah.
could be like, you're going to become an expert in that. And
Yeah.
patients will come to you for that. So be curious, ask questions, find your passion,
Mm-hmm.
help
Agreed.
advocate, help push this damn profession forward.
Absolutely. Remember,
Okay?
we are not just tooth scrapers. We are healthcare hygienists. We learned, we follow the exact same educational path as nurses. Let's use our brains to our full capacity and really elevate our profession
That's
and
right.
really elevate the experience for us as clinicians, but then also for our patients.
That's right.
We're there for them.
Yep. But
So
that wraps things up for today.
that's it.
Another
I think
great
this has been
episode.
a good one of the mouth and the gut inflammation connection.
Yes.
Don't forget, you're all one system, people.
Awesome. Thank
Mhm.
you for listening, and we will see you all back here next Wednesday. Do not forget.
Stay tuned and
Dun, dun,
follow along.
dun.
All right, this has been another Unhinged Hygienist.
Woohoo!